So what Andean Health and Development has achieved is really extraordinary. The world faces a chasm today, and it's been around for a long time, right, in health equity. And then who bears the brunt of that? It's the lower middle income countries. These regions lack access to essential health services, and these problems are compounded by other social issues like poverty, discrimination, and gender inequalities. The Andean model is in really good alignment with the World Health Organization's resolution on emergency, critical, and operative care. In fact, Andean's been doing all that well before the resolution was even passed.
For nearly 3 decades, the Ecuadorian countryside has been our home and our proving ground. We started Andean Health and Development with little more than the best of intentions. The best intentions to serve an underserved rural population. We've learned firsthand how quality rural hospitals like ours can strengthen healthcare systems. We've experienced how training local personnel creates the only path to true sustainability.
En un mundo que pone escritorios entre un médico y un paciente, la enseñanza de la que más orgulloso me siento es que nos involucramos cara a cara. Y hacia esa persona nos debemos.
En Saludeza lideramos alrededor del 70% de mujeres. Nos ha permitido de alguna manera proyectarnos hacia expectativas nuevas, proyectos, educación, innovación, que es lo que queremos aportar nosotros a la sociedad y a la comunidad.
Ese ejemplo invoca que los hospitales deben seguir con las normas de calidad que tiene Saludeza. Como médico me he quedado sorprendido.
So now we're raising our sights. We're driving up from Hospital Hesburg in Santo Domingo up to our new and exciting project site in Cotopaxi. So people have asked us why Andean Health and Development wants to do a project in the Cotopaxi province. And there's some really good answers to that question. The first one is that Cotopaxi is incredibly poor. It's one of the poorest provinces in Latin America, and there's a huge unmet medical need in this province.
Here we are in the heart of the Ecuadorian highlands, under the towering shadow of Mount Cotopaxi, where below we'll be serving the people of Puquili.
Nosotros no contamos con hospitales o con los sistemas de atención pública adecuados para la cantidad de población que existe. Del momento mismo que se empezó a correr la noticia de la construcción de un hospital, créanme que la alegría, la esperanza, la visión, los sueños de todos nosotros se han ido hasta el infinito.
Saludeza ha puesto ya la primera piedra, un hospital de aproximadamente 45 camas, donde van a tener unidades de cuidados intensivos pediátricos que no hay en la región.
And we feel like we can bring those services and really alleviate a lot of the pain and suffering in this province.
Creo que esto va a ser un hito para la salud en las comunidades. También claman por un acceso a servicios de salud.
We are really interested in expanding our training program, and there's been a lot of interest generated by universities up here in the highlands of Ecuador to expand those services to go well beyond just family medicine and include other medical specialties, nurses, administrators, lab techs, and the like.
We're confident in Andean Health's success. Few have built and maintained hospitals in low and middle income countries for as long as and as successfully as Andean Health. And none have their history of training or public, private, and academic partnerships. And I can't really think of any more significant adversity than lack of health care. The fact that their mission is so consistent with what we do, that's really what drove us to initially partner with Andean and continue to partner with Andean. From our perspective, they're not just building a badly needed hospital for an underserved population, rather they're informing the global healthcare discussion.
Our model of Western medicine has never been applied to a large, rural, indigenous population. A population with a drastically different worldview of health. And that is a challenge the world over.
Mount Cotopaxi sits as one of the highest active volcanoes in the world. We at Andean Health and Development aim to lift our mission to a similar height.
By raising the level of care for indigenous populations.
By lifting expectations around what rural family medicine can achieve.
By elevating local research to discover insights that impact global medicine.
That's been our intention since the start, to provide quality, sustainable health care to the rural poor. From the lowest rainforest to the highest mountain, to be shared all around the world. That is our best intention.